before, we didn't look at what the caregiver's choice in how they
Mhm.
became a caregiver
Mhm.
or even
Mhm.
saw that as important. There was just an assumption that this is what you did and that everybody is cut out to be a family caregiver, and we're not. I believe that some people should be supported in
Mhm.
not being a family caregiver.
Yeah.
You don't it's like, "What? You can't say that because we always say,
Yeah.
"You have to be the
Yeah.
caregiver, you're a family member." But not it's not for everybody. It's okay to look for alternatives.
Welcome to the NCA's podcast, Conversations on Aging and Justice. We're excited to bring you a new series, The Evidence Exchange. Elder abuse doesn't make headlines, but it touches millions of lives each year. This series brings together the researchers and practitioners who spent their careers working to change that. Join us for candid conversations about the work, the fields, and the people behind it. To kick off the series, we invited Dr. Donna Benton and Dr. Frank Puga to talk about caregiving, one of the most consequential and often invisible forces shaping the health and well-being of older adults today. Dr. Benton and Dr. Puga come from different generations of caregiving research, but their perspectives intersect at a critical point. Caregiver well-being isn't separate from elder mistreatment prevention, it is central to it. In this conversation, they discuss what drew each of them to this work, how their thinking has evolved along the way, and what they've come to understand about caregiving. Dr. Donna Benton is a research associate professor of gerontology at the USC Leonard Davis School of Gerontology and directs the Los Angeles Caregiver Resource Center. Dr. Benton has over 30 years of experience in providing direct service and support for family caregivers. Her research focuses on the development of evidence-based interventions for family caregivers to improve mental and physical health and well-being and the prevention of elder mistreatment. Dr. Frank Puga is a visiting associate professor of family medicine at the Keck School of Medicine of USC. His research explores how daily stress and social dynamics shape the well-being of older adults living with serious illness, along with their family caregivers. Dr. Puga's work on resilience and mental health among dementia caregivers has helped inform national conversations around caregiver stress and elder mistreatment prevention. We hope you enjoyed this conversation.
All right. Well, I'm excited about today's conversation, Donna. How about yourself?
Yeah, we it's always nice to just talk with you.
Yeah, this is great. I'm glad we had this opportunity to chat a little bit. I guess I can dive right in. You've
Mm.
spent more than 3 decades supporting caregivers. And looking back, I'm just wondering what first drew you to working with caregivers? And when did you begin to see caregiver support as an essential part of preventing elder mistreatment?
Okay, yeah, so you asked 2 questions, so let me
Yeah.
start with the first one, which is kind of what drew me to working with family caregivers. And I always remember when I was working with older adults and then their caregivers would be there, and usually I would we'd be doing a home visit, and even though I was doing an assessment on the older adult, I've noticed the caregiver is usually giving the answer to me. So then I began to think, I wonder what's going on with them because they're kind of talking about what's going on. And then I started saying, hi, what's going on with you? And then I began to hear, nobody ever asked about me. And I'm like, but you're like, if you're not here, then they're not going to be here in the house. And so that's really when it started is when I kept getting the no one's asking about me. I led a couple of support groups. And, in the when I first did support groups, it was both the caregiver and the care receiver, and I noticed that the caregiver would not really talk.
Right.
And so then somebody said, "Let's try to let the care receiver come in a little later." And that's when you started to hear the stories and people "I'm stressed. I don't
Hmm.
really wanna say anything in front of the person I'm caring for, but I need a break," and you just heard that over and over, and then the more I read about caregivers getting sick, and of
Hmm.
course, the story that everyone always says is, "I remember so and so, my dad was caring for my mom, and he died before my mom." my sister was caring for my aunt. She died before my aunt. And so you have to say, what's going on with caregiving? And, why can't we begin to support caregivers? And after that, we also did retreats for
Mhm,
family caregivers. We're
mhm.
like, why do caregivers, and then I was like, of course they need a break. And so we started doing these retreats, and that was my early work with family caregivers. And then, you know, elder abuse has always been, or elder mistreatment. I like to think of it as mistreatment because if you
Mhm.
say abuse, what
Right,
happens? People
right,
think you're just going around bashing older adults.
right.
But we're really talking about the kind of i- intentional, but often unintentional things that caregivers may do that they don't realize it because the person can't speak up for themselves like they used to.
Mhm.
The family member may not realize that you can't tease people, that you can't, like you used to be able to have a banter back and forth, but it's not going to be the same. And so that's kind of what drew me into the prevention part
Mhm.
with family caregivers because caregivers, they may not know that, oh, if they choose not to eat, I can't just go, hey, don't eat.
Right.
And it's out of their own frustration, but maybe before you could do that, but you can't do that now.
Right. Something that strikes me about this too, I think is a lot of times when you are talking to caregivers and like these topics of mistreatment come up, I think a lot of it has to do with just maybe a little bit of a lack of awareness of the
Yes.
disease, right? I think a lot of times people might think that the older adult might be doing things on purpose, right? And so
Mhm.
there's kind of like this reaction to it. And the caregiver is like, well, I'm trying to get them to eat, but they won't eat. And it's so frustrating. And so I think there's a lack of awareness that this is not something that's intentional.
Mhm.
Yeah.
Yeah, because they'll go, "Well, my mom was always difficult,"
Right.
or,
Yeah.
she's always dieting, so, maybe that's what's going on." And no, it's very, very different. And, that reminds me, what I think about your work,
Hmm.
which you really focus on, like, that stress and
Hmm.
resilience and the caregiver mental health. Let's turn it back to you.
Yeah.
What kind of got you to study caregivers for a living with dementia?
What was kind of my motivation is a common story we hear amongst a lot of people that are doing research on caregivers, right? It's usually grounded in some personal experience. And what
Mm,
first really brought me into this is my mother was the primary caregiver for my grandparents,
mhm,
and both of them were diagnosed with dementia. And this was at a time when it was still very new to us. We had never heard of dementia before. And so my family had to start to just think about what is this and how do we deal with it, in terms of providing the best support for my grandparents. And so I saw my mother basically take on this primary caregiving role.
mhm,
And she had a lot of support from other family members, from her brothers, from her sister, from us. I was in college at the time. And so, it was a family ordeal and a family affair. But what we noticed is that my mom still took on the majority of the caregiving responsibilities because my grandparents did live at home. And so what we look back at that time now, we realize that, well, you know what? Mom may have had um, a lot of distress. And actually, she probably had symptoms of depression that was undiagnosed, anxiety. I remember coming home from a visit from college one summer and having
mhm.
a conversation with my mom. And she said, I'm very appreciative of everything that my brothers and sisters do to help. But at the end of the day, they get to go home and I'm still living in it. It's just like you think about family support being essential for caregiving, but not realizing that people's experiences may differ depending on whether or not they're the primary caregiver who has the older relatives living with them at home. And then
Right.
on top of that, I remember my mom saying, from one day to the next, I never know what to expect. And then this became a recurring theme that I started to hear as I talked to more and more people that were providing care to older relatives living with dementia, particularly. And they said, every day is never the same. I started facilitating support groups for people living with dementia and their caregivers, and I heard the same theme. And then I realized, well, what makes some days good and some days bad? And part of my initial thoughts was, well, I want to look at this a little bit more closely. And my first reaction was like, well, I bet you it's because things are harder with symptoms that the person is presenting with on a certain day. And
Mhm.
then I began to realize that it wasn't just that as I talked to more and more caregivers. It started to become this more dynamic experience where it's like, yes, the symptoms were hard today. There was a lot of restlessness, a lot of irritability. But on top of that, I had to worry about five doctor's appointments. People were trying to come visit. There was, I was just feeling so overwhelmed and I had nobody to talk to. So all these other non-care or disease-related things were happening. And so I thought, okay, we need to look at this a little bit more closely. And so this got me very interested in trying to understand day-to-day experiences in caregivers and
Okay.
figuring out what are those daily stressors and how do people respond to these daily stressors. And all this just started from having those conversations with my mom early on. Before I was even in graduate school, thinking about becoming a researcher and going on and talking about this from that perspective.
And so many of us are grounded in our own personal experiences. I
Right.
helped with my mom, with my
Right.
grandmother.
Yep.
And one thing that you said, I was thinking about that day-to-day change where the
Right.
symptoms may be different. But one of the things like, did I get any sleep last
Yeah.
night? How
Yeah.
did I eat the day before? Did I get a phone call and I'm dealing with something completely not care related, but I still have
Right.
to manage the next day?
Yeah. And like that, and it's very real for a lot of people. And again, tying back to my family experience,
Mhm.
I remember my mom telling me, at one point we did have somebody that would come overnight and watch my grandparents in case they woke up so my
Right.
parents could sleep. But despite having that support, my mom still couldn't sleep at night. So she was definitely sleep deprived because she kept worrying like, oh, something's going to happen or I'm going to be woken up and have to
Right.
assist with something. And so, yeah, it's very real that, despite levels of support that can be available, there's still this looming sense of stress and anxiety that can impact one's health.
Yeah, and I think that that's where the research is, starting to move when I start thinking about it's like teaching people that ability to let go. Like you're saying,
Yeah.
your mom, she's worrying about what if somebody has to interrupt me? What if I have to do this? And is saying, trust the person who's there overnight.
Yes.
They've made a promise to take care of your mom. It's not going to be the same way, but you have to let go. Sometimes that's why when we did the retreats, it was so nice because the care receiver, they're not there at all. The caregiver is away at camp. Let's
Hmm.
just put it that you're away. And I remember that one of my favorite things that happened was we would pick up some of the caregivers would get at that time before Uber. We use these kind of private van
Right.
services.
Yeah.
Okay, so the van driver on the way back came over to me and he said, "You told me to pick up like these same 4 people." He says, "I just wanted to let you know, I don't know what you guys did over the last 2 days, but these aren't the same people that came with me." Because he said, "They're smiling, they're laughing." He said, "I didn't recognize them." And then, of course, we talked to them and they would say, "I got a good night's sleep." One gentleman at the end, he was very embarrassed, but he said, I'm embarrassed, but I have to tell you this. I got to go to the bathroom by myself, and
Mhm.
it was the best thing that happened to me in the last 48 hours.
Right.
So it's kind of very basic
Yeah.
things that change for a caregiver that really influence those day-to-day things. So
Right.
training people to do that letting go or,
Right.
educating the
Yeah.
importance of that.
Yeah, and I think that kind of ties also into where I see the field going, I guess, in terms of
Mm.
like, well, we know things are stressful and things are hard. But we also know that some caregivers are actually doing really well in terms of like letting go or adapting to situations. So this brings
Yes.
in that resilience piece, right? And we're trying
Yes.
to figure out what is unique or what are things that we can learn, I should say, from these caregivers that are able to deal with these challenges in a way that seem like it takes a lesser toll on their
Mhm.
psychological and physical health because it's becoming more apparent to me that yes, like we could have the same types of stressors in our caregiving role, but not all of us are going to react the same. And so,
Exactly.
yeah. And so learning from these people that are doing really well, I think it's important that we kind of pay attention to that so that we can hopefully learn about these attributes or these strengths or these skills or ways of coping that people are utilizing that we can teach others how to do that. And so I like that approach because it does take away that focus on like, oh, it's risk, caregiving stressful. Yes, we know that. Like things are stressful, it's hard, but there are ways that we can adapt and, come out better despite the challenges that we may encounter.
And that's what's changed since I began 30 years ago in terms of research. The
Mhm.
research was very focused on burden
Right,
and
right,
stress
right.
but not so much on what you're looking at, which is the resiliency, the strengths. And I think one of the part of our research is we began to look at why certain cultural groups
Hmm.
seem to have lower reporting of depression or lower reporting of stress and burden. And so can we look at those cultural groups and say, what are they doing different? What are the strengths that they are bringing forward that's helping them adapt to taking care of somebody? And so we found out use of faith-based and
Hmm.
prayer and meditation, all the things that we're now
Right,
learning, not taking things on as personal,
right.
um, being able to see the person in the moment and saying, okay, my mom isn't the same as she was, but this is who she is now. This is what she can do. And kind of adapting the family structure around that change. That's one of the really interesting things is how families adapt and
Hmm.
still involve and respect the older adult, continuing to have them as an important figure in the family. So okay, grandma can't remember everything, but you know what? When the younger children are there, she's still good at reading. So let her read stories to people.
Hmm.
Let her tell stories to
Right,
people.
right,
Are they accurate stories? Oh, who cares? They're
right.
entertaining, right?
Yeah, yeah,
And you don't get stressed out if she has the dates wrong and all of that kind of stuff, but it's more that she's keeping the children engaged.
right.
Families just coming together and, finding out what people do best. And
Yeah.
I think that's one of those strengths that families have where you're just like, "Okay, well, you're not cooking the main meal anymore, but you still know how to chop. Sit down and chop, mom."
Yeah, and it's striking to me, and I like this idea because I think it's about individual resilience and family resilience, right? And I
Yes.
think that whole spectrum, and you can even say community and society resilience when we
Oh,
think
yeah.
about the broader like levels of influence in terms of one's caregiving role. Bringing this back to elder mistreatment, when we start thinking about the field in terms of like risk for abuse and neglectful behaviors, well, it's like everybody could fit a certain risk profile. I mean, being a caregiver, taking care of an older adult with cognitive impairment is a
Yes.
risk. But if we
Yes.
start looking more at the resilience and say, okay, what are some things that people can draw on as strengths or promotive resources and assets that can help them navigate challenging situations or handle high stressful events? That is, to me, is probably a little bit more powerful in terms of reducing the likelihood of an abuseful and neglectful event happening, rather than focusing so much, well, you meet this profile, so you may engage in this type of behaviors.
Uh-huh.
So we're going to keep an eye on it, but more so like, let's give you the support you need to build up that family, individual, community resilience, so that we can mitigate these things from happening.
And I think the other thing which has also evolved over time is before, we didn't look at what the caregiver's choice in how they
Hmm.
became a caregiver
Hmm.
or
Hmm.
even saw that as important. There was just an assumption that this is what you did and that everybody is cut out to be a family caregiver, and we're not. And so
Right.
that's another it's like we were looking at different risk factors, but part of it is asking the person, "Well, how did you come to this? And, what's your motivation? Why do you want to do this?" And then they if and when they say they don't wanna do this, it's okay to support somebody to not be a caregiver.
Right.
And I think that's a big surprise I've always had in the field,
Hmm.
is that I believe that some people should be supported in
Hmm.
not being a family caregiver.
Yeah.
You don't it's like, "What? You can't say that because we always say,
Yeah.
"You have to be the
Yeah.
caregiver, you're a family member." But it's not for everybody. It's okay to look for alternatives.
Yeah.
That's really hard as a somebody in social service
Mhm.
to accept.
Yeah.
So that was always a surprise to me. I don't know, have you ever
Yeah.
heard that, felt that?
Yeah, I mean, I've kind of seen that, and that's something that we're kind of looking at in our research is kind of this idea of like, did you have a choice in becoming a caregiver? And we haven't really, dove into that data very much. But another related surprising thing that we have found and that we're explore a little bit more is this idea of family support. And we always kind of think that it's a good thing, right? The more family support you have, the better. But in reality, we're seeing that sometimes that this could lead to more conflict and
Yeah,
this secondary source of stress that makes things a little bit more complicated. And so we're trying to understand in some other studies that we're doing, like these family dynamics and these interactions that people are having with their social networks to see if this may be a source of support or a source of strain. And if they are a source of strain, what can we do to help promote these more family level interventions so that everyone is supported? Because,
yeah,
yes, living it day to day as the caregiver, you're dealing with those maybe possible stressors of providing care. But then when you're dealing with not having the same kind of like plans for your parents or having differences of opinions for grandparents on what should happen, those sources of conflict, I think, add another layer
yeah,
that makes the caregiving situation more complex. And so that has really surprised me. And I think that's where I also see things changing. We have always focused on the dyad, right? The
right.
caregiver and the older adult. And now we're realizing it goes beyond that, right? It is actually not true that everything is that clean cut where it's just a pair of people. It's a network, and there's family caregiving networks. And so understanding those dynamics, I think, is something that has really, I wouldn't say surprised me in the sense that it's important, but surprised me that we haven't given that much attention to it in the past.
I think research is interesting because one of the things is you try to narrow down what you study
Right.
so that you can understand the factors.
Yep.
But then when you narrow down, you miss all of the other things that might
Yep.
be coming into the research that but it's kind of so you always have this paradox of do I study more factors or
Hmm.
fewer
Hmm.
factors and say, okay, I can control this, I can control that.
Right. So I was wondering too, if you think about like your own work and everything that you've done to date, what are some questions or things you wish people would ask you about caregivers or about your work, but they almost never do?
That's kind of a challenging question because people don't ask me very much about my work at all, but I think if people would ask me more about why is this important for aging in general?
Hmm.
How does this apply to all generations? Because the one thing is that when you're looking at caregiving, people tend to think it's you're studying older adults,
Right.
but I always think of it as it's actually something around caregiving really can start at any age and
Hmm.
it's a family education from how you do your planning for your future is all part of caregiving. And so that's one of those things that, like talk to me early. People in their 20s aren't thinking about their caregiving, but they are thinking about like, oh my parents are getting older and I don't know what to do. Not enough people start asking those questions early enough. So
Right.
I think I'd like to have more generational discussions
Yeah.
around caregiving.
Yeah, and I think that's important. And I've seen kind of like this emerging trend of talking about caregiving across the lifespan. And
Yeah.
on top of that, like this idea of sandwich caregiving, right? People that are caring for maybe older parents or grandparents and also providing care
Mhm.
to, children. And
Right.
so there's a lot of that. And especially as you think about a lot of chronic conditions that are starting to appear earlier and earlier
Yes.
these days. And so we're seeing people maybe take on caregiving roles for, middle-aged adults. And
Mhm.
they're not necessarily older adults. It's not like how we kind of view caregiving in the past. I think there
Yep.
is kind of like this spectrum now. And again, going back to like that one size fits all approach, well, that may not work,
Mhm.
because you have somebody that's maybe providing care for a grandparent, but also maybe they have a medically complex children to or a child that they're providing care to as well. And
Yeah.
so those types of supports might be different. Yeah.
Yeah. So is that what advice would you give to someone?
So what advice would I give to somebody in terms of, what they should do for somebody entering the field?
Mhm.
I would say that they probably need to think beyond the caregiving dyad. Okay, so it's not just the person providing care and the individual with a chronic illness or who needs support. There are, like we've alluded to in our conversation today, other important people or individuals that may play a role. It may be within the family, if there's other people helping out in some way. But on top of that, like the relationships you have to make probably with clinicians, with social workers, like there's a
Yeah.
lot of like interactions that go beyond just the caregiver and the person they're providing care to. And so understanding those dynamics, I think, is important. So I would challenge people who are now just getting into the field, whether it's aging, caregiving, or elder justice, to think about how to um, conceptualize, I think, those types of interactions, right? Because again, it's not just what's happening between two people, it's a whole network of things. And like you said, that could be challenging because we try to isolate things out for the sake of science to be able to study things more systematically. But I think with emerging methods and approaches and collaboration that's growing in
Mhm.
the field, there's ways to kind of address these different pieces, I think.
Do you have anything that you wish someone had told you when you first started in this field?
Yeah, I mean, I think one thing that really sticks out, and now that I think about it and I say it out loud, is it just seems like, yes, this is common sense, but maybe it's not common sense for everybody, is that every caregiving experience is different, right? And I think when I came into the field, early in my career, very
Mhm.
naive about things. I was like, okay, you know what? We're going to come up with the solutions that are going to work for everybody. We're going to have these interventions that we're going to develop, and they're just going to work across the board. And then realizing, wait a minute, we got to understand that everybody may have different experiences, not just based in terms of the severity or the type of dementia
Mm.
somebody might be living with or chronic illness, but things in terms of like one's background and context, right? Their age, their gender, their cultural influences, their resources they have available, all
Right.
of the diversity that we see in these areas definitely can influence one's day-to-day caregiving experiences. And I think these are things that we need to pay attention to. And this kind of is going to need to make us move away, I think, from these one-size-fit-all approaches to support and
Yeah.
thinking about how do we identify which individuals need what types of support and when. The timing is also important, right? Because
Mhm.
if you give somebody support for something that may be useful earlier in the disease trajectory or later on in a disease trajectory, it may not be helpful in that moment, right? And
Right. Right.
then they have this resource that they're like, okay, maybe I might need that, and they can't really activate it. So I think that just in time support and those just in time interventions that are tailored to one's unique experiences, I think is critical. And that's something I wish I would have thought about a little bit earlier instead of like, I'm going to fix everything with this one size fits all type of approach to caregiver support.
We want to have the one size fits all because it's easier from a administrative standpoint.
Right, right.
But I always remember there's this baseball quote that I like that our similarities are different. And
Yeah,
that's kind of what's going on is that we know that people are similar, but that they're very different. And we
yeah,
have to take that in. And as I think about people who are starting out, kind of like what you said, is we may start out with this idea that we're going to just fix everything and
Yeah.
right away. But I think when I started out in the field, I think the best thing, what would I tell somebody starting, is that you have to start at the ground. You have to be
Hmm.
involved. I don't like doing research unless you take time to listen and
Hmm.
talk to people.
Yes. Yes.
So talking to the people that you and involving them in how you develop your questions, how you
Hmm.
think about things. But, having listening sessions or focus groups or whatever you want to do, take that time. I feel lucky that most of my time I've been doing direct work with family caregivers before I moved into research.
Hmm.
I mean, obviously you had to do it when you're doing your dissertation and stuff. And I was doing both, but I remember early on, I went in and I was gonna do a survey with older adults and trying to understand about ageism and
Hmm. Hmm.
mistreatment. And I went into the senior center with my little survey, and I was like, "You wanna take my survey?" And everybody's like, "Get away from me.
Yeah.
Who are
Yeah.
you? I don't know who you are."
Yeah.
So then I was like, "Okay, nobody wants to talk to me. Nobody wants to take my survey."
Right.
And so then I went and I started playing cards
Yeah.
with the people at the senior center. We
Yeah.
didn't talk about my survey. And then they're like, "Who are you?" And who's this young person? I was young at one point. Why are you sitting here? And then I started telling him who I was. So like, which is the opposite of what you're supposed to do in psychology is like, well, this is, I'm studying, I'm
Hmm.
gonna get my PhD, and I'm trying to understand about this. But I just played cards for, like, months. Thank goodness I learned a lot of good card games. Cards, pool, ate lunches together, and then they said, "Well, you're doing the study, how are you doing it?" And I said, "Well, I have a survey." And then they're like, "Okay, well, I'll take your survey." And
Yeah.
so then but it became like, "Oh, okay, we can help you, and this is why it's important." You have to take that time to develop a relationship.
Yes.
So, I would say anybody entering into anything, start with talking with the people that you wanna work with.
Yeah. And I think that's very important, especially when you're hitting on sensitive topics like stress,
Yeah.
people's well-being, and even instances of mistreatment. Like, I think if you have that trust built in, and instead of start asking people what could be perceived as like invasive questions, I think it's important. Our ultimate goal is to make sure we have things that reflect the needs of caregivers, and so having those conversations in the community is important.
It's always so nice to just talk with you.
Yeah, I really enjoyed this conversation. I feel like we covered a lot of ground. We could probably talk for hours on this. I always learn a lot from you and respect and appreciate everything that you've done for the field. So,
Oh,
thank you so
thanks.
much,
I
Don.
feel the same about you.
Yeah.
Oh, now we're just having a mutual love fest, whatever.
Yeah. Great.
Thank you for listening to the Evidence Exchange. Subscribe wherever you get your podcasts so you don't miss future conversations. We'll see you next time.